I'm attending the American Society of Hematology meeting that's being held currently in Orlando, Florida. Over 1,000 abstracts on multiple myeloma being presented. I've been asked to comment specifically on quality of life issues comparing stem cell transplant with CAR T therapy. I think it's not a simple question to answer at this point in time because there are different patient populations. In patients who have stem cell transplant, they're usually early on in the disease, early in the therapy, have a relatively low disease burden. As a consequence, they usually have approximately 4 months of fatigue, appetite loss, inability to gain weight. After that, they've recovered to normal baseline functionality, and the only residual side effects that impact quality of life is what maintenance therapy they're receiving. CAR T therapy currently is really being administered to patients with very advanced disease, multiple relapse, so they come into it with a lower quality of life because of the disease burden that they carry. Patients with CAR T often require frequent hospitalization for monitoring against cytokine release syndrome. One of the nice things about CAR T therapy is once it's been completed and patients respond, which the majority do, there's no maintenance therapy and they usually recover to their baseline within 30 days of the completion of the infusion itself. There is a proposed study that looks at induction transplant maintenance and directly compares it in newly diagnosed patients to induction CAR T maintenance. That's a perfect study that will ultimately answer the question as to quality of life issues between those two technologies.